Hello. We are presenting on a research paper titled Parents' View of Care of Their Very Premature Babies in Neonatal Intensive Care Unit, which is a qualitative study. We are a member of three. My name is Kencho Angmo, and we have Bungsu Zina and Himanshu Nagi. Uh, the health issue and rationale behind this study is that the adverse effect from preterm births related to deaths, disability, and a lot of cognitive and behavioral difficulties, as well as added psychological and emotional stress to the parents. And then evidences have come out that if you create enough experiences, awareness on these experiences, staff are able to better support the parents and have positive impact on the recovery of the infants. So that's why this research was conducted so that parents experience during their preterm babies as well as immediately after birth was conducted. The study methodology used was qualitative study with the purpose of sampling of babies born before 32 weeks of gestation from three tertiary centers in Southeast Asia. Key informant interviews were conducted to collect the data sample. Carried out by experienced psychologists, and data was analyzed using inductive thematic analysis and the N Vivo version 10 qualitative software. And the study was given ethical clearance from the National Research Ethics Committee of the Southeast Coast. I now hand over the second part to my friend Himanshu.
Hi. Talking about the sampling part, there were some inclusion criteria which were taken into account, like parents were only eligible to take part in the study if their baby born before 32 weeks of gestation, and parents must be able to speak English fluently. Parents were also recruited if at least one member of the couple wanted to participate or if they were eligible. Most importantly, parents of babies who died were also included in the study. Recruitment process took place at three tertiary care centers in Southeast England by the posters in the neonatal units or by the letter of invitation. Parents returned a letter indicating their willingness to participate in the study. Talking about the sample size, 32 mothers and 7 fathers were interviewed to explore their experiences. There was a potential of biasness as the recruitment process took place at only three tertiary care units, so the sample size was not the whole representative of the population. Talking about the data collection, the questionnaire consisted of 12 open-ended questions, and the questions related to parents' experiences during the birth and their satisfaction with care were asked with the asked them. And the questionnaire was administered to obtain the socio-demographic information. Parents were not asked any direct question about their experiences or in neonatal care units. Basic obstetric and neonatal data was collected from medical records. Talking about the role of interviewer, it was just to obtain the accurate data and just to calm the parents. That's all about me, and I want to hand over the rest part to my friend Zina.
Thank you. And now we will talk about the data analysis and key findings. The data were examined through a thematic analysis technique, which involved reviewing transcript interviews to identify recurring themes and patterns related to parents' experiences in the NICU and grouping these themes into broader categories. This method was chosen for its ability to systematically explore qualitative data, allowing it to capture the complexity and nuances of parents' experiences, so this method is appropriate for this study. However, this method may introduce subjective interpretations and overlook certain perspectives. Despite its limitations, thematic analysis offers flexibility and adaptability. Providing a detailed account of participants' experiences also encourages reflexivity and ensures the trustworthiness of the results. Additionally, using NVivo software enhances the analysis process. Next slide, please. Several key findings are: 1. Parents' engagement. Uh, Active involvement in caring for their premature babies, such as breastfeeding, cleaning, nappy change, and baby holding, significantly impact parental satisfaction with NICU treatment. Second is staff competency. So, effective communication and information provision by NICU staff are crucial for parental satisfaction. And the last is interpersonal relationships. Empathy, emotional support, and personalized interactions with NICU staff contribute to positive parental experiences. Limitation of findings might be biases in participants' responses and interpretations. So, parents may experience a gratitude bias towards the carers who cared for their preterm infant, making it difficult for them to express negative feedback. Furthermore, sample size and demographics may limit its generalizability. The findings are applicable to parents of pregnancies in NICS, especially in similar cases. However, it's not applicable to different ethnic backgrounds, particularly in developing countries where trained health workers and health facilities are less advanced than in developed countries. This study is relevant to clinical practice since it emphasizes family-centered treatment and offers practical measures to improve parental satisfaction. These findings can help healthcare workers improve the quality of care given to parents and very preterm babies. That's all from us. Thank you very much.
Thank you.